helping people help their pets fight cancer. That's next on All for Animals. Hearing that a loved one has been diagnosed with cancer can be devastating, and that goes for our four-legged family members as well. Dr. Joshua Louis Lachowicz is a veterinary oncologist at Blue Pearl Veterinary Partners, a specialty and 24-hour emergency animal hospital with 3 locations in New York City, in Manhattan, Brooklyn, and Queens. And he's not only saving animals with cancer, he's also helping their people who may not be able to afford the cost.
Cats and dogs and other animals actually get the same types of cancers that humans can get. In dogs, we see quite a bit of lymphoma, very similar to non-Hodgkin's lymphoma in humans, and then we also see quite a few skin tumors like soft tissue sarcomas, mast cell tumors, and a host of other types, bone cancers, cartilage tumors, you name it. Cats, we actually see quite a bit of lymphoma as well. Usually in cats, though, lymphoma develops within their intestinal tract, so it can actually present much differently than swollen lymph nodes. It actually will present as GI upset or vomiting diarrhea. In cats, we also see quite a bit of mammary tumors, skin tumors as well, and then a host of other tumor types.
And so what would be the primary signs and symptoms that a pet owner should look for?
To be honest, it will vary across the board. So you should look at their general demeanor, attitude, interactions with their owners, appetite, energy level, and then other specific signs like coughing, breathing problems, sneezing, for instance. And then you can also see issues like vomiting, diarrhea, loss of appetite, weight loss, and things along those lines. So it could be very general or it can be very specific depending on the type of cancer they're diagnosed with.
What kind of testing do you do to make the diagnosis?
Testing is going to actually be very similar to humans as well. So we'll start with basic lab work, CBC, chemistry, urinalysis, and then we'll also do screening or staging tests that will look at chest. So we do x-rays of the chest, and then we do abdominal ultrasound to look at their belly, and then we do advanced procedures like CTs, MRIs as needed. To get a specific diagnosis of cancer, it will require some type of either cell sample, which we obtain with a cytology or a fine needle aspirate to get those cells, or a biopsy. A tissue biopsy is where we actually will go in and get a piece of tissue to tell us what the cancer or the mass or the malignancy might be.
Treatment for people is generally a combination of surgery, chemo, radiation. What about in pets?
Exact same, across the board. Think of pets as being little humans in a way. So we're actually going to do the same types of treatments. Surgical removal of tumors, surgical removal of masses. We'll use chemotherapy for high-grade tumors, and then for liquid tumors like lymphomas, again being one of the more common cancers we see at least in dogs and cats. We also use chemotherapy for metastatic tumors and things along those lines. And then there's a host of other types of treatments we use that may not be conventional. Anti-inflammatories, steroids, and things along those lines, often used in conjunction with the standard like surgery, chemo, and radiation.
Treatment, as you can imagine, can be expensive, and not everyone can afford it. But Dr. Joshua is doing something to help.
The Joshua Louis Animal Cancer Foundation, I helped co-found it in 2011, and it has 2 primary missions. Our first mission is to raise awareness about the advances that have been made in veterinary oncology, and our second mission, which is really our most important goal, is to raise money for the treatment of cancer in animals when owners are unable to afford the cost of therapy. That's what our main goal is.
Joshua Louis is Dr. Joshua's stage name. Turns out he's also a singer-songwriter and is using his passion for music to help animals through his foundation.
It is so easy to wait for the right time or the right moment.
The stories, everything that happens as a veterinary oncologist, that inspires me to write music. The music is recorded, what's recorded can be purchased, and what's purchased actually goes to the foundation so people can afford the cost of cancer therapy. It's my way of giving back to those that give to me.
Right here and now. No more pain or sorrow, no. 'Cause now we turn today to tomorrow. Yeah.
How many pets have you guys helped so far?
To date, we have actually been accepting applications for slightly over a year, and we have helped over 25 animals and we've actually donated over $50,000 in funding so far.
Dr. Joshua's practice involves cats and dogs, but his foundation will help fund available treatment nationwide for other kinds of companion animals, too. You can get an application online at joshualewis.org. You can also help out.
We do events in and around the New York City area. We, of course, have nationwide, fundraisers through music and other things. If you can make a donation, visit us, support us in any way, even if it's coming out and volunteering for an event, the more the merrier.
Again, for more information, visit joshualewis.org. And remember, if you're thinking about adopting a pet, please make yours the next great rescue story and head to a shelter near you. I'm Susan Richard. Thank you so much for watching, and we'll see you next time on All for Animals.